there. And so I would like to say that training is a very key aspect of our Neolife business, because when we come to Neolife, we have 4 basics, and that is to use the products, to share the products with other people, share the opportunity, and to train. So training, I think, is one of the biggest pillars. So when I came to the Neolife opportunity, I had a challenge with fibroids. And I was actually afraid. I mean, I don't know who brought about stigma, but I was afraid. I was feeling as if I would be stigmatized. So I didn't actually tell anybody in Neolife. I was given Provitality, and I started feeling better, but I didn't talk about the fibroids. So there was training every Tuesday evening at 8, like today. And I faithfully attended trainings for 3 months. And the program of fibroids did not come up because nobody knew that that is what I was interested in. But luckily, because of the cycle of trainings, somebody should actually miss trainings. One time I came and I saw the topic written there, fibroids program. So I was very attentive. I still have the notes I wrote on that day. I remember it was a PROs who was training, and I was helped. In fact, I stepped up to senior manager using fibroids products. And let's say the rest is history, because I have progress. So today, that's what I would like us to look at. So just a brief introduction or what is uterine fibroids? Fibroids actually affect the uterus. So what are uterine fibroids? These are non-cancerous growths or tumors of the uterus that often appear in women during their childbearing age, that is between 30 to 50 years. These uterine fibroids are not associated with increased risk of cancer. I'll stress that one even if you see it on my screen. Fibroids are not associated with increased risk of cancer and almost never develop into cancer. So anyone who is having a lot of problems with fibroids and a lot of fears should just stop those fears and just do the necessary to reduce all the discomforts. Another point, 80% of women develop fibroids by the time they are 50 years old. But some of them never even get to know because those fibroids are asymptomatic. I think we are very familiar with asymptomatic during this COVID season, where they say 97% of people infected with COVID are asymptomatic. So also 80% of women develop fibroids actually by the time they are 50, but they never know because they are not symptomatic. So only 20% of these women have symptoms, a very small percentage. And somehow I was among those 20%. Fibroids range in size from being undetectable, meaning very tiny, to being bulky masses that can even distort the uterus. You can have a huge thing growing on your stomach. That's why for some women, they think they have a false pregnancy or something, and then kumbe it's just fibroids. So fibroids, they range in sizes. So I guess those 80% of women who have fibroids and they are not symptomatic, probably their fibroids are not big enough to cause any symptoms. Fibroids can be a single one, moja tu, ama multiples. Personally, I had 10. So you can have just one fibroid growing, or you have 10. In extreme cases, multiple fibroids can expand the uterus so much that it reaches the rib cage and cause pressure on the surrounding organs like the pancreas, the bladder, the cervix, and other organs around the rib cage. So fibroids can expand. They can grow kind of uncontrollably. I usually say they are like magugu or weeds, growing in the wrong place. So here is a picture of fibroids. So as you can see, you can see that abdominal cavity there. So the fibroids often grow from the uterine muscle. If you can see the muscle, the uterine muscle, this is the muscle of the uterus and the one on this side. So fibroids grow from the muscle. Then now from the muscle, they can grow inwards into the uterine cavity or grow outwards, like this called subserosal. This one is growing outward. This one called submucosal is kind of growing on the inside part. And this one called intramural is in between the muscles of the uterus. And you can have this one called intracavity is growing into the uterine wall. And you can see this one has the tendency to become very big because there is space enough to fit baby. So this one can grow even to the size of a baby. And the one up here is growing on top of the uterus, kind of facing towards the abdominal, where the stomach is. So you can see the fibroids, they grow on different places, and the doctors give these fibroids different names to help them locate where they are, so that when they are treating you, depending on the name, they can tell where they are. So they have different names depending on where they grow. So there are signs and symptoms of fibroids. So the ones that I have written here are the general symptoms that most women with fibroids have. But different people may have different symptoms depending on the size and the location and the number of fibroids. So women with fibroids have women with fibroids, some of them have no symptoms, okay? We've said that. But in those who do have symptoms, this can be influenced by the size of the fibroids, the location of the fibroids, and the number of fibroids. So here are some of the common symptoms. One is an enlarged abdominal cavity, an enlarged abdomen, like in pregnancy. I experienced that one myself because I have a small stature. So if I have anything growing in my abdominal cavity, itaonekana haraka sana. So, there are women who are huge. So even if something is growing within them, you can't differentiate that there is something because their tummy is generally big. Now my tummy is small. So when you have something growing there, it will just pop out. And in fact, I remember one of my upline directors was enjoying me. She thought I was actually expectant when I came to join Neolife. And then 1 year on, there is no baby and the tummy has grown smaller. So she was really confused. What has happened to this lady now? I'm sure she hasn't given birth, but what has happened? So you can have an enlarged abdomen as if you're pregnant, 4 months, 5 months, and it keeps on increasing, 6 months, 7 months, Then number two, you have heavy menstrual bleeding lasting for more than 7 days. Okay, heavy menstrual bleeding. My screen has moved a little faster than I wanted. Yeah, okay, so yeah, we are back there. Heavy menstrual bleeding lasting more than 7 days. Number 3, pelvic pressure or pain. Lower abdominal pain. So there is that discomfort. You can call it pressure, discomfort, or in some instances, pain of the lower abdomen. Number 4, frequent urination. But even as you have the frequent urination, or just always feeling pressed, like you have to go to the bathroom, but you don't fully empty the bladder. Number 5, there is digestive challenges like constipation, bloating, flatulence, and all these cause lower back pain, and all of them are unexplained. Okay, so we can go to the next one. So they are usually risk factors. As I was researching, I saw that there are no known causes of fibroids. The doctors do not know any causes, but they only have risk factors. So I'm going to share some of them. The most common risk factor is hormonal imbalance, especially of estrogen and progesterone. Those two hormones are the ones that are responsible to help you conceive, if you need to conceive. That is mostly estrogen. And then when you have already conceived, progesterone increases, and that is what keeps the pregnancy intact until the time of delivery. So if you have an imbalance between these two hormones, then there can be a problem, especially when the estrogen levels are elevated and they stay high for quite some time. That first point is related to point number 2, where when you use hormonal contraceptives, you actually mess up that balance. I remember I did that myself. I had I had 3 pregnancies without using contraceptives, and then I think those babies were following each other too quickly. So I said, no, I have to slow down this process. So I used hormonal contraceptives, and during that time, I must have developed fibroids around that time, but there were no symptoms, so I couldn't tell. But I remember I developed goiter that grew so big, I had to be operated on to remove it when I was expecting my 4th child. So I remember asking the doctor, my gynecologist, I asked her, why is it that I have developed goiter that has grown so big within a span of 2 years? And she told me that that is part of the side effects of the hormonal contraceptives that I was using. So I got so annoyed with her, I threw away the pills, and actually that's how I conceived my 4th baby. So with that, I can tell that the hormonal contraceptives actually were the ones that caused my goiter to grow so big. That one I can be sure. So when someone is using hormonal contraceptives, there is a very high chance for you to develop growths in different parts of your reproductive system. And for me, I believe I developed goiter and also developed fibroids, but the fibroids were too small to cause any problems. And because I conceived immediately, so huyo mtoto aling'ang'ana na hizo fibroids akatoka without being affected because they were not too big. But I remember soon after, around 1 year later on, I conceived again, but it became an ectopic pregnancy. You see, now my system was already corrupted. So it became an ectopic pregnancy. So I had to use an intrauterine device as a contraceptive because I was told If I have developed, if I have had, if I have a blocked tube somewhere, I could easily have another ectopic pregnancy. So I was advised to use some contraceptive. So now I couldn't go back to the hormonal contraceptives because I knew the side effects. So I used the intrauterine device, which also caused other problems because it used to make my uterus to kind of, I think it's a form of reaction. So I used to have a swollen uterus, which was uncomfortable and sometimes painful. So I ended up just throwing away all those contraceptives na nikakaa hivyo. But I think my tubes were already blocked, so I wasn't able to conceive again. Not that I have a problem with that because my 4 babies, I think they are enough. So other than the hormonal contraceptives, not for everyone, but for some people like me, it really brought a lot of issues. Then there are also genetic factors. That is not so much researched, but remember these are just risk factors. Nobody knows exactly what causes fibroids. So there are genetic factors. Some researchers also say racial factors. Like they say, we the Black women, we are more likely to develop fibroids at a younger age. We are likely to develop larger fibroids and have more severe symptoms. So somehow we the Black women ndio tuko na mashida kidogo. Another risk factor is heredity. If your mother had fibroids, then most likely you will. So in my family, there are, I think there are three of us have developed fibroids. So we are 7 girls, and 3 of us developed fibroids. So probably my mother had fibroids, but they were not symptomatic. Another risk factor is early onset of menstruation. If you start your menstruation early, then you are more likely to develop fibroids later on in life. Another risk factor is obesity. Obesity. Another one is vitamin D deficiency. Another risk factor is diet, which is high in red meat and low in green vegetables. I think most of us, have those challenges. And then consumption of alcohol tends to increase the risk. So here are some of the risk factors, but it's not an infection, it's not anything. So in a way, there is very little you can do to avoid it unless you avoid the hormonal contraceptives. You can manage your weight, and of course, you can take supplements, as we are going to see. So let's go to the next session, which is complications. Remember, I said fibroids are not cancerous and fibroids will never kill anybody. But when you are having that challenge, you feel as if you're going to die. No, fibroids will never kill anyone. But if they are left unattended, they could come up with other complications accompanying the challenge of fibroids. And one of them is anemia because of bleeding too much, bleeding for too long. So you can easily develop anemia. So anemia, for me, that is really what I suffered from. Mine went to severe chronic anemia, and part of the symptoms for severe chronic anemia is weakened immunity. That's what I suffered from. Weakened immunity, chronic infections and so on. I even suffered from memory loss. Yes, things like that. I used to have swollen feet almost all the time. Like when I could travel, my feet would really swell. And so many other symptoms associated with anemia. So for me, my fibroids affected me through the anemia. That is why I was very sick. It was actually anemia. Another complication includes inability to conceive. If you have fibroids sitting in your uterus, they interfere with the implantation process. There is nowhere for the fetus to attach itself, or the embryo to attach itself, because there are already things in the uterus. And then the contractions, they are kind of, when the uterus always contracts periodically. So when now there are fibroids and then the uterus contracts, they even make the space inside there, the uterine cavity, is small. So it's very hard for a pregnancy to survive ikifika pale when there are already fibroids occupying the space. So there is inability to conceive. And then also, because of those same challenges, you find women miscarry. When there are fibroids in there, it is very easy for a woman to miscarry. And one other complication is disruption of everyday normal functioning. Because you can imagine, if you are having fibroids and then you bleed so much, you might have to take an off from your place of work because you can't handle, the bleeding and other things like that. So the normal everyday functioning is interrupted. So those are some of the complications. If anything can be fatal around here, probably if you have the severe chronic anemia, it might be fatal. But of course, you will reach hospital before anything bad can happen. So women, let's take care of ourselves. Okay, so when do you see a doctor? Because I've said fibroids are not, life-threatening. But when do you see a doctor? So you see a doctor when you are experiencing these symptoms. Number one, pelvic pain that does not go away. So either the fibroids has become too big and it is sitting on some nerves and interfering with other organs around the abdominal cavity. So when your pelvic pain doesn't go away, that's the time to see the doctor. And then overly heavy, prolonged, or painful periods. Ikifika hapo, then you go and see a doctor. Then spotting or bleeding in between periods. Yeah, that's another sign that you need to go and see a doctor. Recurring urinary tract infections, what we call UTIs. Then unexplained low blood count, or maybe it's anemia. Or if you have a miscarriage once, you see your doctor to find out why. Okay, so now let's look at the medical interventions. The medical interventions, one of them is uterine artery embolization. These are medical terms. There's somebody raising their hand there, Purity. Kindly attend to Lois is raising her hand. I don't know if she can't hear me. Yeah, PT Purity, kindly help there. Through which this is a process through which the blood supply to the fibroid can shrink or die. That is what is called embolization. When I was talking to my doctor, she told me that this particular intervention is done outside the country and it was too expensive. So she told me this was not an option. Surgery to remove the fibroid. Those who are still quite young, you can have surgery to remove the fibroids. And then surgery to remove the whole uterus is called hysterectomy, done for women with very severe symptoms, or women who don't want to have any more children. Yeah, so maybe in the age of 40, 50, you can have a hysterectomy. And then fibroids will naturally shrink when one reaches menopause. That is, if there is something you can do with your fibroids to help you go through until you reach menopause, the fibroids will naturally shrink, because the amount of estrogen and progesterone, to propel their growth is no longer available. So fibroids can actually shrink naturally when you reach the age of menopause. But there is a point to note here that for all procedures except hysterectomy, that is removing the fibroids, seedlings are tiny fibroids that are beginning to grow. So the seedlings that the doctor does not detect during the surgery could eventually grow big enough to cause symptoms that require intervention. So what we are saying here is all the procedures I've mentioned above, all those medical interventions, they actually remove the fibroids, which is there, but others will grow if the real underlying reasons why they were growing in the first place is not being addressed. So that is where the Neolife solution comes in, because Neolife will address the root cause of these fibroids developing in the first place through the training that we give about how to eat, and also the relevant supplements. So I want us to look at the Neolife solution. We say Neolife addresses the nutritional deficiencies that contribute to the growth of the fibroids. And also in Neolife, we train on what to eat, So for the guests who are here, I think it's really advisable if you are here for